In this video, Dr. Paula Kruppstadt discusses the rise in chronic illness in kids, what's causing it, and how functional medicine can help. From infections to toxins, she shares real, actionable ways to support immune health with tools like supplements, herbals, IV nutrition, and more, providing you a path to clarity, not fear.
The content provided in this video is for educational purposes only and is not medical advice. For medical advice, please schedule an appointment with one of our Hope for Healing providers or the appropriate medical professional. This material is the property of Hope for Healing and is not to be shared or replicated in any way without written consent. Thank you.
There's some great changes taking place right now in the United States as far as our view on health. Chronic illness in children is terrible and it's escalating, and we have reasons to show why. Hope for Healing, for the decade that we've been in existence, has been flying under the radar because we don't want anyone to attack us. But what are we talking about? We're talking about eating healthy food that's not adulterated with pesticides and herbicides. We're talking about what causes autism. We know it's not just one thing, but right now is the time to see how you can help your child. Now, we talk about environmental toxins, we talk about the toxins that you ingest, but also as we look at the political milieu of our country, I'm apolitical, but I'm saying that we have support for functional medicine because it moves the needle, and we have examples for that.
So we're hearing a lot about how infectious diseases and are increasing in children. So what have you seen as being a pediatrician for how long?
35 years.
Right. So you've had some experience over the past 35 years to
Yes.
see. So what are you seeing and why do you think you're seeing it?
Especially in the last year, but this spring, we have seen persistent and aggressive elevations of antibodies for several infections. One of them is bacterial called mycoplasma pneumoniae. It can cause brain inflammation and lead to children having acute onset neuropsychiatric problems, severe anxiety. The other is Epstein-Barr virus reactivation and just strep off the rails. So we know that we can treat group A beta hemolytic strep with antibiotics. Here's what we're seeing with mycoplasma. We actually just reached out to an allergist immunologist in our area, and she's seeing this too. And we think what has happened is that, and I'm going to speak this because it's the truth and it's well documented in the medical literature. Individuals who have been vaccinated with COVID mRNA injections are continuing and persisting to make spike protein up to 500 days after their injection. And that in turn is activating the immune systems of everyone in society. That spike protein concentrates itself in reproductive tissue. This is not a lie. This is truth. It's proven. And we believe that this transmission, even for people who've never been vaccinated, but they've just had COVID, it's causing molecular mimicry and abnormalities with the elevation of these antibody levels, especially for mycoplasma in children, leading to brain inflammation. So that's where at Hope for Healing, IV ozone, IV insufflations with ozone, and IV therapy to support the immune system and kill these organisms and drive down inflammation is so imperative, especially in your children.
Everything that I hear you saying is incredibly scary and can be really overwhelming. And what I just honest question, Dr. K, is there hope alongside this for people who've gotten the vaccine or haven't gotten the vaccine or they're just scared to be around people? Like I mean, you talk a lot about how fear even makes things worse. So can we talk about the hope in all of this?
Absolutely. The beautiful thing is that we have the ability to drive down spike protein in the body. And then for mycoplasma treatment, especially drug resistant, when we see patients, we usually use antibiotics. And at this point, we're using two. And then how do we support the body? We use a lot of herbals too, because they do
Mm,
no harm. And that's the thing. We don't want people to live in fear, but you have to be cognizant of what has happened to the world, that
right.
we don't have the resiliency that we used to have.
Mm. Okay, so you said that we use herbals as well as antibiotics. And so for those who may be scared to use antibiotics,
Mm.
what kind of like connection or what kind of help that we have alongside using something like antibiotics?
Well, specifically for mycoplasma, we recommend the antibiotics, and I'll tell you why.
Absolutely.
Mycoplasma behaves like a virus. It doesn't have a cell wall.
Mm,
We use something called macrolides as our first line of defense. That's azithromycin, which is like a Z-Pak, uh, and or clarithromycin, which is Biaxin. We rarely use erythromycin. And what is so unique about azithromycin or a Z-Pak or Z-Max is that it is, or a Z-Pak, it is consumed by white blood cells and taken in the body to where the inflammation is most. So, where those organisms are, it eradicates them. There's a better
mm,
chance of eradication. Mycoplasma leads to tics too, vocal, motor tics, and OCD.
mhm. And so if we're going to be giving people antibiotics, how do we support their system alongside those antibiotics?
Yes, we know that when you use broad spectrum antibiotics or even narrow spectrum, they can disrupt the normal bacteria in the gut.
Mm,
So we tend to use a probiotic that is a whack-a-mole for yeasty overgrowth. And we
mhm,
recommend taking it for 3 full months when you take it while you're taking the antibiotic away from it and then afterwards. But for people who don't want to use an antibiotic, and maybe they're not as severe, if you're severe, you need those antibiotics. They are a
right.
tool that we have that works very effectively.
Hmm.
So as far as herbals go, there's a little trifecta of herbals that works really, really well with COVID and spike. And if you're doing a lot of traveling or you're in enclosed
Hmm.
spaces, and we don't have to live in fear. We don't. And of course, there's hope.
Hmm. So, for the people who may not be experiencing any of these symptoms right now, right? So, they're not dealing with these bacteria, they're not dealing with these viruses. And is there anything that we would encourage them to do to keep staying supported?
Yeah. All the lifestyle modification factors, eating a real diet with real fruits and vegetables, real organic, grass fed beef and meat and poultry and
Hmm.
wild caught salmon, those kind
Hmm.
of things, drinking clean water, getting out in the sunshine, moving your body, getting good sleep. But we are using a lot of immunomodulatory herbs
Hmm.
that are antiviral. Um, there's a couple that you can do daily or pulse them, especially if you're going places like I'm getting ready to leave town to go to a wedding and,
Yeah,
flying on a plane and all that. And so using those things to support my body, vitamin C, vitamin D3 with K2, those are helpful, but also just not living in fear. Okay.
right. I love that. I think, in addition, so when you were talking about traveling and ways that we can support our system with all these different vitamins and stuff, um, let's just touch a little bit about like the therapies we offer that help people when they're traveling, help people when they're under stress, help people. Can you talk a little bit about why this is so much more beneficial, especially in times of stress, especially with what we're dealing with? Why is this so much more helpful than, say, taking a multivitamin, or not even just taking a multivitamin? Let's say we take them all individually and we have this special formula. Where does functional therapies come in play?
Huh, great question. Well, think about it. You know, when you're stressed, you're driving to this school activity, this little graduation, this wedding, doing this, traveling. We get out of our normal routine. We stop drinking as much
Mm,
water, and we may end up going through a drive through and eating something that's not nourishing to our body, or you forget things. So, what happens is you build up acid in your cells and you become acidic, and it takes you longer to recover. Your cortisol levels go up, you're stressed, and you need more nutrients. And what I love about getting an IV is that it's equivalent to 6 weeks of oral supplements, and it's 100% bioavailable. But if you hydrate yourself, get yourself some vitamin C, throw in some minerals and B vitamins that you know is going to get absorbed. Or even if you're like really in a crunch, you know, we can do that in 30 to 45 minutes, but you can also get something called the lipovitality injection, because lipovitality is like a multivitamin on steroids, but it also helps with weight loss. You know, it's a
it's added
boost.
benefits.
Yes, or the B complex, because it really
Mm,
helps with energy. It can be so tiring, but we just forget
mhm.
the normal things and we neglect ourselves and we push through, and we're building up all that acid and stressing ourselves out. So,
Absolutely. I think something I, so with the way I worded the question was how we can support ourselves when we're feeling well, which is like we take all these vitamins, we would add in the functional therapies. But I want to correct maybe something that I might have said that might have been a little confusing. When I am also sick, when I am not feeling well, I think sometimes that can be the last time that I would want to leave the house, right? I just want to be in bed. I don't want to do anything. Um, but can you talk a little bit about how, even though we're sick, even though our children aren't well, even though all these things are happening, would where functional therapies could play a place in that?
absolutely. I mean, that is the most important time to get in. You're sick.
Mm,
It will decrease the duration of your illness if you give yourself some IV vitamin C. Using that, and if you're not feeling well and you don't want to eat and you're not getting out of bed, just by using the vitamin C, it can kill viruses, and it can
mm,
change the way that our immune cells are showing up, T cells, B cells, and decrease the duration and the replication of viruses. So, number one, if you go to the effort to come in, you get the hydration, you get the antioxidant support, you shut down the life cycle of those viruses, and you recover faster. And while you're there, we're going to squirt a little ozone in your ears and up your nose. And that's going to help eradicate it too. But
mhm.
I know it's counterintuitive, but when we're sick is the time that we actually need it the most.
Absolutely. Well, and I feel like that's the hard part, right? It can feel so hard because so frequently when we're filling out, like in conventional medicine, when we're filling out like doctor forms, they're like, well, have you been around someone sick? Don't come. And so that can feel very different where we're like, no, if you're feeling sick, please come. And
Yes,
we want to support you in this time, not just when you're feeling great. We want to support you when you're not feeling well. And we have special things. I love when I go into like the Ivy room and I see family members of like this family member isn't feeling well getting a drip, but this family member feels great but doesn't want to get sick and is getting a drip, and to kind of see how that has helped. I mean, we've have like actual stories of people um who are like pregnant and can't do some of the more conventional things and the herbals and all of that stuff and aren't able to do that. And their family got sick so frequently, but she came in constantly getting drips throughout her pregnancy and she never got sick. And she was like, this is amazing. Like, I've been sick so many times. And again, when you're pregnant, it lasts longer. Like,
Yes.
because you can't take all the things that other people can. And so she was like, I just wasn't miserable. This was the best pregnancy yet. And so
Yes.
it's really cool to hear these stories, not just to, like, yes, I love when Dr. K comes in with the facts and the science and the backing, and then to see it live out and to see it come to fruition. Dr. K, before we wrap up here, I really want us to end on like maybe like a summary or something in a way that just provides we where your heart is the hope that people have in this really scary world
Mhm.
and scary time.
Yeah. We're not meant to live in fear. When we live in fear, we stress ourselves out, we deplete our cortisol, and we get sick more often. So there's always hope, and that's why we name the practice Hope for Healing. But there's so many tools in our arsenal to get better. And it doesn't take a lot. And I
Mhm.
just love many times some of the things that have been given to us by God, which are herbs, and they're purified, and there's excellent science to back it up.
Mhm.
And so, and that goes for everybody. When the world tells you you can't get better, take this, take that,
Right.
you can. So,
Mhm.
yes. And then that way we're not living in fight, flight, freeze, or fear all the time. We all struggle with that.
I love it. Thank you so much for your time and really taking all of this into consideration and um, building a world of truth
Mhm.
and hope and ultimately healing. Thank you so
Great.
much.
Thank you.
Want more information on how Hope for Healing can support you and your family? Schedule a free welcome call with our team today. And as always, subscribe for more real conversations on root cause healing.